Assalamu alaikum. Welcome back to our channel. Invest in your health. Today, we're going to talk about a topic that's often avoided: hemorrhoids. We'll explore why people avoid discussing them with their doctors, what the hemorrhoids are, their types, and the role our lifestyle choices play in their development. So, let's get started. One question that comes to mind is, why don't people discuss hemorrhoids with their physicians? The main reason is an embarrassment. Hemorrhoids are considered a taboo topic, due to their location and the stigma surrounding them. However, if someone feels embarrassed and doesn't share their hemorrhoids problem with a physician, they may not receive an appropriate diagnosis and treatment, which could lead to worsening symptoms and increased discomfort. Untreated or improperly managed hemorrhoids can result in complications such as thrombosed hemorrhoids, anemia, or infection. Additionally, hemorrhoids can sometimes be confused with other medical conditions, so not discussing the issue with a physician may delay proper diagnosis and treatment. Lastly, without professional guidance, an individual may resort to ineffective or inappropriate self-treatment, further exacerbating the problem. What are hemorrhoids? Hemorrhoids, also known as piles, are swollen veins in the lower part of the rectum and anus. They are similar to varicose veins and can occur internally, inside the rectum, or externally, under the skin around the anus. Common symptoms of hemorrhoids include itching, pain, discomfort, swelling around the anus, and bleeding during bowel movements. Hemorrhoids types. Hemorrhoids can be classified into two main types based on their location. Number 1, internal hemorrhoids. These are located inside the rectum and are usually not visible or felt. Internal hemorrhoids are further classified into 4 grades based on their severity. Grade 1. Small hemorrhoids that do not prolapse, protrude outside the anus, and generally cause mild symptoms, if any. Grade 2, hemorrhoids that prolapse during bowel movements but retract back inside the rectum on their own. Grade 3. Hemorrhoids that prolapse during bowel movements and require manual reduction, pushing them back inside the rectum, by the individual. Grade 4. Hemorrhoids that are prolapsed and cannot be manually reduced. These are the most severe and may require medical intervention. External hemorrhoids. These are located under the skin around the anus and are more likely to cause discomfort and pain. They can sometimes form a blood clot, thrombosis, which may cause severe pain and inflammation. External hemorrhoids are not graded like internal hemorrhoids. Both internal and external hemorrhoids can cause symptoms such as itching, discomfort, swelling, and bleeding during bowel movements. Treatment options depend on the type and severity of the hemorrhoids, and may include lifestyle changes, over-the-counter remedies, or medical interventions. Role of constipation to make it worse. Constipation can play a significant role in making hemorrhoids worse or even contributing to their development. When a person is constipated, they may experience hard or infrequent bowel movements, which can cause straining during defecation. This straining increases pressure on the veins in the lower rectum and anus, which can lead to the formation or worsening of hemorrhoids. In addition to straining, spending a long time on the toilet due to constipation can also contribute to hemorrhoid development or exacerbation. Prolonged sitting on the toilet increases pressure on the rectal and anal veins, further aggravating hemorrhoids. Oily foods. High-fat and greasy foods can contribute to constipation, as they may slow down the digestion process, resulting in harder stools that are more difficult to pass. Straining during bowel movements can worsen hemorrhoids. To prevent this, opt for a well-balanced diet with lean proteins, whole grains, and plenty of fruits and vegetables. Spicy foods. While spicy foods do not directly cause hemorrhoids, they can irritate the gastrointestinal tract and lead to looser or more frequent bowel movements in some individuals. This may result in increased discomfort, itching, or irritation in the rectal and anal regions, especially if you already have hemorrhoids. If you notice that your symptoms worsen after consuming spicy foods, it may be helpful to reduce your intake or avoid them altogether. Drinking plenty of water can help soften stools, making them easier to pass and reducing the strain on the rectal area. Consume a high-fiber diet, including fruits, vegetables, whole grains, and legumes, to help soften stools and reduce straining during bowel movements. Engaging in regular physical activity can help improve circulation, stimulate bowel movements, and reduce pressure on the veins in the rectal area. Gently clean the anal area with warm water after each bowel movement, and avoid using harsh soaps or scrubbing, as this can further irritate the hemorrhoids. Pat the area dry or use a hairdryer on a low setting. Applying ice packs or cold compresses to the affected area for 15 to 20 minutes several times a day can help reduce swelling and alleviate pain. Soaking in a warm bath or using a sitz bath, a shallow basin that fits over the toilet, for 15 to 20 minutes several times a day can help relieve pain, itching, and inflammation. Sitting on a cushion or pillow, especially a donut-shaped one, can help relieve pressure on the affected area and provide comfort while sitting. When using the restroom, avoid straining and take your time to allow your body to pass the stool naturally. Over-the-counter treatments, like stool softeners or milk of magnesia, can be used to manage constipation if needed, but consult your healthcare provider for personalized advice and treatment recommendations. Thank you for watching our video on hemorrhoids. If you found it informative, please give it a thumbs up and subscribe to our channel for more health-related topics. Don't forget to share your thoughts in the comments section below, and let us know if you have any suggestions for future videos. See you in the next video.